Well, in fact, milk doesn't actually build bone. That's a great marketing and PR campaign by the dairy industry. But they're just drinking, milk, for example. It doesn't really protect bones. In fact,
Exactly.
calcium and vitamin D only reduce fractures about 18 to 20%.
Let's ditch the quick fix and dive into today's conversation.
Welcome, everybody. My guest today is Dr. John Neustadt. Dr. Neustadt was founder of Montana Integrative Medicine, founder and president of the dietary supplementary company Nutritional Biochemistry, Inc., and NBI Pharmaceuticals. He's the author of 4 books, including most recently, Fracture Proof Your Bones, A Comprehensive Guide to Osteoporosis, and that was released in 2022. Dr. Neustadt received more than a dozen U.S. FDA orphan drug designations and is a member of the Bone Health and Osteoporosis Foundation Corporate Advisory Roundtable. Dr. Neustadt is Vice President of the California Naturopathic Doctors Association and Chair of the Membership Committee. Dr. Neustadt has published more than 100 research reviews and was recognized as one of the top 10 cited authors in the world for his work. Welcome, Dr. Neustadt. It's exciting to have you here today.
Thank you so much. I'm really excited for the opportunity to share what I've learned.
Awesome. And we're gonna talk quite a lot about bones. But before we go there, I kind of in prep found that you have a little bit of a history in journalism. So maybe start kind of back a little bit and lead us up into where you are today.
Back when I finished my undergraduate degree, I thought my goal was to be the great American novelist. I actually wanted to write fiction and lived in Chile for a year where I got a job as a journalist, moved back here because during that time I wanted to then be an environmental writer, but I didn't have a background in the sciences. So I thought I would be more open to manipulation if I didn't have the scientific education where I could access the primary data, the studies, and read them and understand them for myself. So I actually came back and applied for another undergraduate program, this time up at the University of Washington. In that intervening year, I was a journalist and the editor of a bilingual Spanish-English language publication in the Bay Area, and went back to school and did a whole nother undergraduate degree. This time I got a BS in botany. And during that time, however, I realized I really didn't want the life of a journalist anymore. So I went into high tech, which obviously people know in Seattle up there in the Pacific Northwest, a lot of high tech companies. I ended up being a technical writer for them for a while, and then found my way to naturopathic medical school when I started to get sick and I didn't understand what was going on. I went to my insurance MD, just literally picked from a list. I'd never been to, I was in my 20s, or early 30s. I'd never really been to a doctor before or needed one, and went and wanted to understand what was going on, had questions I wanted to ask. And I could tell very quickly that he was primarily interested in just writing me a prescription and getting on to the next patient. In fact, he walked in the room with his prescription pad in hand and became rather impatient by the questions that I was asking. And after that, I walked away with the prescription in my hand, not feeling satisfied. I didn't get the service or the understanding that I wanted. I'd heard about Bastyr University down the street in naturopathic medical school in the Seattle area. So I thought, well, let's give these folks a try. Let's see what they have to say. Loved the service. The chief medical officer happened to be the attending doctor during the appointment with 2 student clinicians. They spent 45 minutes with me, very patient, answered all of my questions, and got to know me so well in that appointment, in addition to giving me important things that I could do with lifestyle and diet and stress reduction to really heal and improve my health without the medication that was prescribed. The attending physician looked at me and got to know me so well. At the end of that time, he looked at me and he said, "You need to quit your job." That was the underlying cause. And one of the philosophical underpinnings of naturopathic medicine is to identify the cause and treat the cause of what's going on so people can heal and not just mask symptoms. And I did. So I think it was seriously the permission I was looking for, the validation I was looking for what I had already was leaning toward. I was interested in natural health and integrative medicine for years, was a rock climber and did mountaineering. I'd bike to work and had my own garden, grew most of my own food. So the next week I went and quit my job and started enrolling in naturopathic medical school. And while I was in school, I still have that journalistic mind of love researching, love understanding, and want to communicate through writing. I figure if I can communicate succinctly in writing what I've learned, that's my test that I actually really understand it.
Boy, I love that. It's such a wonderful journey to kind of have that lifestyle and then just kind of come into a situation where you go, wow, this is exactly where I think I need to be entering into Bastyr. So you went to Bastyr, graduated from Bastyr, and out of that, you started into your own practice?
Yeah. So I say we, because my wife was part of this journey. Of course,
Sure.
we met just after as I was applying. So she went through all of it with me, dating, and we got married while I was in medical school. She got pregnant, about 9 months pregnant when I graduated. So we moved to Montana, which is where her side of the family is from, to start our family and start my practice. And we were there for 6 years. Grew my clinical practice, and during that time, I working with nutritional medicine with patients, I was trying to help them, but there weren't products already on the market that the dose or form or combination of nutrients shown in clinical trials to actually work. So I'm very solutions oriented. I created a company to create those line of products to fill that gap and fill that need to help my patients. And it grew from there. We're now in San Diego. 2011 moved down to San Diego, which is the area I'm from originally. And so we're here now.
Medical information has become tough to sort through. Between politicization, institutional bias, and mass media, it's become tough to find the things that lead you to getting healthy. The Unaverage Health Summit is a free online video event for people seeking natural methods to kill brain fog, eliminate bloating, blast fatigue, and live optimally. You'll get access to discussions with natural health experts like Dr. McCullough, Dave Asprey, Dr. Petros, Dr. Schaffner, and many others on the cutting edge of medicine. It's happening soon and only available for a limited time. Go to unaveragehealth.com to get your free ticket to this online event. That's unaveragehealth.com. Again, it's free and access is ending soon. This is a great opportunity for you to continue your journey to becoming the best health advocate you can have. Hope you take advantage of this. And you became a doctor that took care of a lot of people who are having a hard time getting help anywhere else. I think I saw the quote, "Doctor of Desperation," in your history.
Unfortunately, a lot of people aren't getting help from the conventional approaches, which still typically mask symptoms. They don't look at the body holistically and from an integrated perspective. Conventional doctors aren't trained in any meaningful depth or meaningful way in nutritional medicine or botanical medicine, lifestyle counseling, exercise. And that reductionist approach, while amazing for acute care and
Yes.
amazing when necessary, when I'm not opposed to medications, I have prescribed medications when needed, but there's so many other things that people can do. A lot of people, though, aren't getting help from that conventional approach, and those are the folks that would end up in my office, which was fascinating for me and fantastic because it means I didn't already have to do the conventional workup, the standard blood tests or imaging. Those were typically already done, and I could focus on nutritional medicine, functional testing, things that were in my wheelhouse and my expertise beyond the conventional approach that we are already taught in naturopathic medical school to help people get better.
Yes. And it's something I try to share a lot in conversations. There's such a huge importance of the medical approach to acute emergency care. I mean, it's just I think one of the best systems in the world here in the United States. but there's just a big imbalance. People too many times are looking to that as healthcare, and it's really not really healthcare. It's emergent care. It's the acute care that, hey, we need to put back, some of the body parts that you just broke on your motorcycle or your car wreck or that kind of thing, and some of these acute infections and heart problems, and but real health is the how you take care of yourself, like you're starting to develop for us today. And so I'm just hopeful that we can get a better balance between the two approaches to health, so that people really do understand they have to be their own health advocate, kind of a thing. So within that, how did you come to be focused on bone health?
Like I mentioned in the book, I never thought, bones, I would have never pegged me for focusing on that or getting an expertise in that area. But as one of my mentors taught me, that your patients will tell you what they need. And I kept having people show up with osteoporosis. So I continued to sort of dig more and more into the research and the literature to understand fundamental mechanisms and what do clinical trials show actually work, and bone density scans, how valuable are they? And I just started going down this road, and it led me to create one of my first formulas and products to help people, because the clinical trials on nutrients and the research was so clear that what was on the market and what people were doing to help their bones with just taking calcium and vitamin D, their doctor thought they would protect it. They thought they were protected, and they weren't. And similar, if their bone density test numbers go up, they think they're protected, but fracture risk and is much bigger than just a bone density test.
And so, yeah, and I want to get into some of the supplementation that you've developed and that you share in your book. Before we go there, maybe just kind of the idea that a lot of people have about bones is do the bones just wear out? What's happening with bone health itself, just in the basic sense?
Bone is a tissue. It's a complex tissue, like all tissues in the body. It's made up of different elements. So there are two primary cells in the bone, the osteoblasts and the osteoclasts. Osteoblasts build up new bone, osteoclasts break down old bone. And you need a natural, healthy balance of the two, because bone gets worn out and old bone gets broken down and new bone gets rebuilt about every, cycles through this, where you're regenerating bone in a healthy system. But there are other components to bone besides just the minerals that people think of, like calcium. There's collagen in bone. And in fact, there are over 200 proteins in addition to collagen that are in bone. So it's much more complicated than just saying, oh, let's look at the mineral content of the bone and do you have enough minerals, and let's take minerals. The peak bone mineral density happens when people are in their 20s. So that's when it's thought that we reach our peak bone mineral densities, and it starts to decrease from there. But it's not a one-way street. The studies are very clear. We can rebuild bone, we can strengthen bone, we can provide and create a healthy environment within the bone, within the body, that supports that bone growth through really into old age.
Right. And that's I try to share with my patients a bit that, really anatomically, we're still pretty young. It's just we're not rebuilding and repairing ourselves very well unless we take on some good strategies. So what are, that collagen element, what's kind of the importance of collagen as far as it goes to bone health?
So collagen is actually what gives bone its ultimate strength. So there's bone, the concepts are, there's bone quantity, which are the mineral content of the bone, which is measured by a bone density test. And there's the non-mineral component of bone. 90% of the collagen in bone is type 1 collagen. And that gives bone its ultimate strength. So collagen is a strand of amino acids, a repeating sequence of amino acid, three actually strands wrapped around each other. The image I have in my mind is like rebar.
Okay.
And so it gives the scaffolding onto which the minerals bind. and it also provides some flexibility. So people probably are familiar with the rubber chicken gag with
Yeah.
jokes. Well, my histology professor actually demineralized a chicken bone and brought it to our lab class when I was in medical school. He soaked it in vinegar, and that leaches out the minerals. And what's left is the collagen, the non-mineral component of the bone. And it was very flexible, like a rubber chicken. You could bend it, but not break it. And that's what the collagen does, healthy collagen does in the bone. When somebody falls, it allows the impact of that force to disperse over a little bit wider area. The bone actually can deform a little bit and absorb the impact and not break. If the collagen goes away and you're left with minerals, it's brittle. It's essentially like a column of chalk that can just break apart very easily.
And and not to jump into medications and their shortcomings, but that's one of the reasons why the meds typically fall short, is they're really not addressing the full complexity of bone tissues, right? And so I'll table that for a second and come back to it and switch gears to the bone testing. You kind of mentioned that there's bone testing and there's different types of testing. Maybe share a little bit about the testing and the benefits of it and positives and negatives of it.
Sure. So bone mineral density testing is something that I do recommend because it's one component, one piece of the puzzle. But like any tests, the number on the test result is what we call a surrogate marker. It's not clinically the most dangerous thing that we're trying to prevent as clinicians working with patients. With osteoporosis, the most dangerous thing with the disease is breaking a bone. It's not the number on a test. In fact, we've known since the 1990s, it's been known that a bone density test only predicts 44% of women who will break a bone and only 21% of men. And in fact, the North American Menopause Society and anybody who's really looked at the research has concluded that fracture risk depends on factors largely other than bone density.
Mm-hmm.
And so bone density test is just one piece of the puzzle. I find myself when people come to me and want to talk about bone health and osteoporosis, it's usually when they've had a bone density test and they have some bone loss and have pre-osteoporosis or what's called osteopenia, or they have full-blown osteoporosis and they are scared. It's a scary diagnosis. If you have osteoporosis and you break a hip, there's up to a 20% chance that you're going to be dead within a year. And half of the people who survive that year never get back to their full pain-free functioning that they had before. So a bone density test, though, result is not the end all be all. And I'd spend time putting it into context of saying, yes, it's one piece of the puzzle, but fracture risk depends on factors largely other than bone density. So just let's put it in its proper context. Yet let's use it as a marker, a signpost that is one indicator of bone health and one indicator of fracture risk, but not the only one. And frankly, not the most important one. There isn't really a test that is the most important factor that we can point to and say, this test predicts fracture risk better than anything else. It just doesn't exist. The bone density test, for example, does not show how much collagen somebody has in the bone. A CTX test, telopeptide, it's abbreviation for that, is a protein that's a breakdown product from collagen. It can show you if you're having collagen breakdown, and that's a good indicator, and it's associated with osteoporosis. But again, it's a lab test, and it is not the best predictor of whether somebody will fracture. It's just one piece of the puzzle. Similarly, the CTX test is even more valuable or more predictive if somebody has lower estrogen, if their estrogen is also lower. And so and then there's another blood test that most people don't most doctors aren't familiar with, and it's the lymphocyte to neutrophil ratio. Those are white blood cells, which are an indicator of systemic inflammation. systemic inflammation is a risk and is associated with osteoporosis. In fact, people with inflammatory diseases like irritable bowel disease, also ulcerative colitis, Crohn's disease, rheumatoid arthritis, autoimmune diseases in general are inflammatory, have an increased risk for osteoporosis and fractures. So when this lymphocyte to neutrophil ratio is elevated, it's been associated with bone loss and osteopenia and osteoporosis.
Gotcha. And that kind of speaks to the gut health importance of bone health. If your gut's not working right, it really doesn't assimilate correctly and allow for the body to be efficient in its repair and rebuilding. Correct me if I'm wrong there, does that make sense?
Well, does anything that can create chronic inflammation is a problem. And in our society, I think it's evident we have a pro-inflammatory diet. The standard American diet is pro-inflammatory. It's too high in pro-inflammatory omega-6 fatty acids, too low in the anti-inflammatory omega-3 fatty acids, too low in fiber. And fiber helps feed those healthy gut bacteria. We take a lot of medications in this country that can kill the healthy bacteria. We're under a lot of stress, which also can affect the microbiome, the bacterial makeup of the gut, and skew it in an unhealthy direction, which can promote inflammation. Sleep deprivation also does that. So all of those things can affect the health of the gut and can set up a toxic system, a toxic situation in the gut where you have inflammation going on.
Yeah, and you can pick it up on that test. How about trabecular bone health testing? Is that a good? I know it's relatively new test, testing the trabecular type of bone. Are you familiar or utilizing that at all?
So I think you may be referring, are you referring to a CT scan, using CT scans to?
Well, it's a new test, and it's a bone health, and it's basically testing the trabecular bone and not just the cortical bone. That's where the DEXA test really does its work, right, on the cortical bone.
Correct. So the question I would have, I'm not familiar with that
Okay.
technology. The question is, has it been validated, and how well does it predict a
Yes.
fracture? And what's important is not just the relative risk of fracture, but the absolute risk. How predictive is it of a fracture? If it and has it been validated?
Gotcha.
So for example, if I can just on the testing, so one thing that's really great is a lot of people have abdominal CAT scans, especially Medicare patients. Who quite a few of them have had abdominal CAT scans, and that will get some of the bone. And there's now technology where people have had that. They don't have to necessarily go in for a separate bone density test. That data can be repurposed into a study that correlates with bone density. But the fracture, here's the rub: the bone density test is the gold standard. So all technology, whether it's a CT scan or an ultrasound, they're comparing it against a bone density test, which isn't very sensitive or specific either. So you're comparing not a great test to one test to not a great test, and you're saying, well, it's just as good as a bone density test is what CT tests have been shown to do. But it gives an opportunity because too many people are not getting bone density tests. And one of the important things with that is just helps people become aware, and they start to become more proactive about their important bone health once they get that test result.
Yeah. And so maybe kind of jump into a little bit more. You've touched on a little bit of the demographics of, bone density issues, but what is the prevalence, overall in the ages? Is it just the 60 and over, or is it, starting to see some problems at the 30, and a 30-year-old age range, or, what are the demographics and prevalence?
So the challenge with looking at younger ages is that a bone density test isn't valid for anyone younger than 50 years old. And a T-score, that is. So a T-score on a bone density test is what is required to diagnose osteoporosis and osteopenia. A T-score of lower than -2.5 is diagnostic of osteoporosis. And you have another score called a Z-score. that's given out on a bone density test. And for people younger than 50, you mentioned 30s, that's what needs to be used. And it can't be used to diagnose osteoporosis. It's just used to look at, are they losing bone? And then with the understanding that if they are, that we need to look at secondary causes of osteoporosis. And so the current demographic is really, primarily women. 80% of osteoporosis cases are in women, 20% are in men. And postmenopausal osteoporosis is the most common. The 10 years after menopause is the time period where you have the fastest rate of bone loss. And that's thought to be because of the drop in estrogen. So bioidentical hormone replacement, for example, is one strategy that some clinicians use to try and help patients. But it is primarily a disease that affects women, and women, 52 and older. You start, and the older people get, the higher the risk. However, bone loss starts years before it's detected on a bone density test. So anyone who's concerned about their bone health, it should start young in life. I think as early as possible, it should be on people's radars. If a woman's mother had osteoporosis, they're automatically in a higher risk category. So they should be proactive about their bones at a younger age. If a person is on medications known to cause bone loss and osteoporosis and fractures, it's really important that they become proactive. And there are medications that aren't even on doctors' radars to look for, very common ones. So acid reflux medications, the proton pump inhibitors, for example, the acid blockers, those increase hip fracture risk by up to 60% in one study. A Journal of American Medical Association published study a few years ago. And it's well understood that risk is there for those medications. They were never actually approved for long-term use. Over half of those prescriptions are because of acid reflux, and they're natural, as you know, I'm sure, integrative and natural ways to help people with acid reflux, to help them get off those medications or avoid them altogether. Diet's a huge factor for many people. Common medications that doctors know of are prednisone and the estrogen blocking medications like anastrozole that's often used with women with breast cancer. But there was a study that showed, they looked at the medications in the months prior to somebody having a fracture and going into the hospital, and the medications they were prescribed and they were taking after they got out of the hospital with the fracture. And yes, the doctors looked and they took them off the common medications that cause osteoporosis and increase fracture risk, but they put them on other medications that they probably weren't aware of that actually increase their osteoporosis and fracture risk. So the net was zero gain. The same amount of people were still taking medications that cause osteoporosis and fractures even after they left the hospital. Another common category of medications that create fractures and osteoporosis are some of the antidepressant medications, the selective serotonin reuptake inhibitors and the serotonin norepinephrine reuptake inhibitors. People probably know, for example, Prozac. That's the most, I think, commonly known.
Right?
Yeah, those can destroy bone. And people just aren't aware of that. And especially with the pandemic and COVID, and many, many more people are taking those. So even women in their 20s or 30s or on them, if they're taking those medications, they need to understand the implications of that, or the potential risks of that.
It's huge. And I think in your book, you said that basically every 30 seconds or so, there's an osteoporosis related fracture happening. Correct. Across the planet. Is that right? And something like a $17 billion cost. Is that just in America to address that?
That's in the US, I believe. I'd have to look at that figure specifically. It's been a while since I've looked at that data. But osteoporosis is more people spend time in the hospitals for osteoporosis than other diseases like heart disease, heart failure. And it's right up there in terms of its effect on people's quality of life and their health, was breast cancer and diabetes and other diseases that are more commonly thought of when people think of risks to their health, and they really should be thinking about their bones as well.
I found that fascinating. I'm being in the world I'm at. I was not aware that the prevalence was so high, and it had that same kind of prevalence as some of these other diseases that you more commonly associate. Hey, these are the things that people suffer more from. But no, osteoporosis is huge, and I see patients all the time with osteopenia and osteoporosis. One of the things that I know the question is, it's kind of the chicken and the egg thing. People will fall and they'll fracture. How often, what's the data show on how often is it the fracture first and then the fall? And, or is there much data on that?
No, there is. 95% of fractures occur because somebody falls. It's typically, they don't fracture first, except for in very rare situations where they're on bisphosphonate medications like Fosamax.
Okay.
And that can cause an increase. Paradoxically, it can actually increase somebody's risk for fractures, because while it's laying down new bone, it's laying it down and stimulating new bone growth in an unhealthy, weaker pattern. And there are stories of people taking these medications in medical journals of case series where people have. One woman I remember reading her case was, she was watering a plant, was on a step stool, and literally, turned to step down, and she had a femoral fracture, her upper leg fractured, just stepping down from that without a fall. But typically 95% of fractures occur because somebody falls. So anything we can do to reduce people's risks for falling, which is important. Unfortunately, as people get older, I think 90% of the elderly are on some medication that increases fall risk. Benzodiazepine medications that are often given for anxiety and sleep increase people's risk for falling and fall related injuries. So
yeah, impacts their ability to just have basic good vestibular system balance, natural balance, right? That is such a huge point that I hope people understand. So what are, we kind of got some of the risk factors, some of the negative impacts of medication. What are some of the approaches to building strong bones? It's much more than drinking milk. So,
well, in fact, milk doesn't actually build bone. That's a great marketing and PR campaign by the dairy industry. But they're just drinking, milk, for example. It doesn't really protect bones. In fact,
exactly.
Calcium and vitamin D only reduce fractures about 18 to 20%. But that's not typically where I start. I don't start with dietary supplements. I really want to lay the foundation with people for long-term health. That'll promote not just their bone health and target that, but beyond that as well. Other risk factors for other diseases. And it starts with diet, lifestyle, sleep, and connecting, things that I call the 4 pillars of health. So the research is very clear that the more people adhere to a Mediterranean style diet, eating more of a plant forward whole foods diet, fewer processed foods, less red meat and more lean proteins, the lower their risk for osteoporosis and fractures. With diet alone, it's been associated with about a 20% reduction in fractures, which is incredible, because look, we all have to eat. So you might as well eat to feed your health and nourish your health instead of feeding diseases. The other things is exercise, moving. There are simple things people can do. I love the stork exercise, and I teach that a lot to people because it's so practical, and I love practical solutions. Stork exercises while somebody is brushing their teeth, with hopefully everybody does twice a day for 2 minutes at a time. You stand on one leg while you brush the bottom teeth for a minute, and then you switch to the other leg while you brush the top teeth. And that'll help promote somebody's balance. People can, steady themselves if they need it on their sink, on the counter, or something like that. But that's just, you can work things into your life. Taking stairs, for example, instead of the elevator or escalator, parking further across the parking lot when you go to the store and walking across. It's all cumulative and adds up. then obviously there are other things that people do. If they want to work out in a gym, if they want to do gentle yoga or Pilates or things of that nature, that's available. But there's with a caveat that, people with osteoporosis who do that, if they have severe enough osteoporosis, doing exercises incorrectly can actually increase their risk for fractures. So it's really important to work with somebody who's trained and understands how to coach and work with somebody with osteoporosis effectively and safely. The other thing that I think is often lost is stress. People are, especially in the US these days, under a chronic high stress, and that increases cortisol production. And that has been associated with increased bone loss. Even people with, quote unquote, within the normal range. So blood tests were given for cortisol, and it was the normal level of cortisol was towards the high end, though, of the normal range. They had faster rates of bone loss. And when you're not getting enough sleep, that increases cortisol. Sleep deprivation, insomnia, not getting good restful restorative sleep has also been associated with bone loss and osteoporosis. And when people are sleep deprived, research has shown that when they drive a car, it can be as dangerous as if they're drunk driving. So it increases the risk for accidents, it increases the risk for falls, it increases all of the risk for all of injuries associated with all of that, including fractures. And the other thing that's important is connectivity, which is part of stress reduction. That's connecting to other people, having purpose. Research, and I talk about this in my book. I think it's sort of, I don't mention this in my book, but I think it's part of the lost art of living in our modern society. And that is connecting and having purpose and volunteering, or whatever lights you up and excites you and gives you purpose. People who volunteer because they're intrinsically motivated, not that they're trying to climb the social ladder. And they looked at those two issues, and people who have more of a social support network, those have been associated with lower, what's called all-cause mortality, meaning lower risk of dying from any cause, which includes osteoporosis. So that's an important piece of setting that foundation for long-term health and longevity and enjoying the years that we have here. And then there are dietary supplements. And one of the things that I think is really important with dietary supplements, if you're looking at nutrients and using them, is to ask the question, have they been shown to reduce fractures in clinical trials? So there are companies out there saying, well, product X or nutrient Y has been shown to reduce, to improve bone density. Well, that's great. But as I've already mentioned, a bone density test only predicts 44% of women who will break a bone and 21% of men. So the gold standard to really know is, has it been shown as the endpoint in the studies, and hopefully it'd be multiple studies, independent studies, showing that it reduces fractures, not just grows stronger bones indicated by a bone density test, but reduces fractures, which is where the rubber meets the road with this disease.
Yeah, that's so important. So some of those tips, and I did get a chance to get through your book, and I really appreciated the connectivity, trying to be in some type of a group or volunteer program or something that keeps you connected, so you're not in that lonely and hey, life is hard to get excited for. You have to have something that kind of energizes the body to want to repair and rebuild. So I appreciated that part. And then coming into the supplements, you've got some specific supplements that you've developed as well. If I'm following correctly, not all vitamin K, for example, is the same, and the combinations, the bone mineral combinations, are kind of important. So, what are some of the products that you have developed that are been shown to be very helpful?
So, when you look at clinical trials that show that a nutrient maintains strong bones or supports bone strength, again, that should be indicated by not just bone mineral density, but on reducing fractures.
Fracture risk.
And there are only 4 nutrients actually that have been shown to reduce fractures in clinical trials.
Okay.
Calcium, vitamin D, MK4, a specific form of vitamin K2, and strontium.
Okay.
I don't like strontium. I don't use strontium for several reasons. One, strontium is a mineral. It incorporates into bone like calcium does, but because it's a mineral, it gives and it's heavier than calcium. People taking strontium have false bone density test results. Now, I mentioned before, bone density, it's not the end all be all, but it's one important piece of the puzzle. And from my point of view, in my opinion, we want to get accurate tests. We want to understand accurately. Beyond that, strontium has been shown to reduce fractures about as much as the bisphosphonate medications, about 44-45%. But it's also now understood that it's associated with an increase of dangerous blood clots. In fact, studies have come out that have said for every one person that's helped by strontium, we would expect one additional dangerous blood clot, a pulmonary embolism or venothromboembolism. And MK4 is a form of vitamin K2. MK7, as you mentioned, is another form of vitamin K2, both available in dietary supplements. Both have been shown to promote healthy bone density, improve bone density. Vitamin K is a category. So these are both forms of vitamin K2, but in biochemistry, we know that they're not the same. If they were identical, they'd have the same name. They're different molecules. If you change one atom in a molecule, it can have different activity. So what we find in the research is that MK7, there are no clinical trials looking at fractures as an endpoint, as the primary endpoint in the study with MK7 and showing that MK7 actually reduces fractures. In contrast, MK4, there are over 25 clinical trials. It's the most researched form of vitamin K2, dating back decades. Over 7,000 volunteers shown to stop and reverse bone loss. But more importantly, there are at least 5 clinical trials that have shown, looked at fractures as the endpoint and show that it reduces fractures as well in the volunteers in the studies. 2 meta-analyses have been conducted that concluded, both of them, that MK4 has the potential to maintain bone strength as indicated by reducing fractures, in one of them by over 50% and the other by 70%. So that's why MK4 in the dose used in the clinical trials, 45 milligrams per day, is in my Osteo-K and Osteo-K Minis products. Calcium and vitamin D. Vitamin D is interesting because what we see, and I do believe it's important to get their vitamin D levels tested, because the benefits from vitamin D seem to be dependent or associated with the vitamin D levels in the blood. So what we see is that for reducing fractures, you get the maximum reduction when the vitamin D level in the blood is between 30 and 44 nanograms per milliliter. The optimal vitamin D, blood or serum, vitamin D levels, however, many people think it's higher because vitamin D has other systemic effects in the body for immune support, for example.
Right.
The research indicates that, 50 or 60 and above. And in fact, toxicity of vitamin D doesn't typically occur until it's above 100. So there's a huge safety window there. It's very safe. So for bone health, 30 to 44, but I'm an advocate of really trying to get up above 50 because you get the bone benefit, but you also get the immune
system
as well. And so those are why those 3 nutrients, calcium, vitamin D, and MK4, and only those are in my products, because what I'm trying to do is target something very specifically. People often say, well, why isn't there magnesium in your product? Well, because magnesium's never been shown to reduce fractures ever. And I'm a big fan of magnesium, don't get me wrong. I love magnesium. But if you're just looking at what do the clinical trials show, that's never been shown to reduce fractures. And we're already talking 3 nutrients, and you're looking at potentially 70% reduction in fractures in people or higher, people taking them. It's incredible.
Just with those 3.
Just with those 3.
So what about, we've talked about collagen. Is collagen supplementation supportive and just not shown to be reducing risk fracture? Or how would you put collagen in the conversation?
That's fantastic. So there are other nutrients that have been shown to, potentially have some benefits on the, again, the surrogate markers.
Yes.
Not necessarily a bad thing to take. but I think they are complementary to those main three nutrients, the osteo-K or that are in the Osteo-K Minis products. And collagen has been shown, I mentioned CTX earlier, as people have elevated levels of CTX in their urine or their blood, it's indicating that they have some collagen breakdown. A clinical trial where collagen was supplemented showed that CTX was reduced in those people, showing that you have less collagen breakdown. There's no indication that I've seen, or no studies looking at actual fracture reduction. Similarly, looking at melatonin. Melatonin was given in clinical trial, and it showed that it did help promote bone density in one but not all sites, and it also did not reduce. They didn't look at fractures as an endpoint. So I discuss all of these in my book and in the research, so people can understand, the options. I would say there, if we're going to categorize them as first, second, and third, it's those first three nutrients I talk about are the top ones, and then the other strategies are complementary to those, and are probably good things to follow. But if you can only do one, those are the three nutrients to be taking.
Yeah, I think that's a great way of putting it. So you're kind of getting close to wrapping up here. All of a sudden, time is just flying by. What are a couple of just summary take-home points that you would have for us today?
I think the big picture is to really understand that bone is much more than just a bone density test, and that fracture risk depends on factors largely other than that. And when you take a holistic approach, you can look at these different variables and factors to reduce your risk and help to build stronger bones and reduce your risk for falling and reduce your risk for fractures, while also improving your overall systemic health and enjoying your years in your life, hopefully as long as you possibly can.
I love that. And that does, I did miss one question that I'll throw in there here too. Sure. The home safety tips, I think, in your book are really good. I mean, I've shared a lot of those in my practice, but I think you just can't emphasize those enough.
Yeah, the home is where people spend most of their time. It's where a lot of falls and fractures occur. So there are tips in the book of what to do with your home, simple things, simple modifications you can make, that most of them don't even cost any money, to improve the safety in your house and reduce your risk for falling.
Yeah, that's great. Well, it is really awesome. There's a lot of great information in your book, and it's just really user friendly. I really highly recommend, getting the book Fracture Proof Your Bones. It definitely is a comprehensive guide, and it touches on all bases. And so I love what you're doing and what you're doing to help people understand what's going on and how they may have a chance to take care of themselves. So thank you for joining us today.
Thank you so much. I appreciate the opportunity, and if people want to learn more about my work, and they can go to mbihealth.com. The book is available there, also on Amazon. And I hope it helps, because it's an epidemic in this country. It's incredibly dangerous, and it should be on everybody's radar.
Absolutely. And thank you for sharing where people can follow up with you. All right, everybody. I hope you have a great day, and take care of your bones.